I'm a board certified psychiatrist, and it's my mission to make psychiatry accessible to providers. And so in this video, we're going to be covering the difference between integrative and standard psychiatry. If you understand, this is going to help you to treat more complex patients, have them get better outcomes, and have them have less side effects. So for decades, standard psychiatry has had the standard paradigm of treating solely with medications, the 15-minute med appointment, and maybe a therapy referral. But now things are shifting. Patients are wanting a deeper level care. They want more holistic care. They want to find out the root causes of things. They're getting tired of medication side effects. They're not enjoying the fragmented care, how it's split between different people. They're having partial responses to treatment and not fully getting better. And just feeling like these treatments are a band-aid and not a cure. And so that's where integrative psychiatry comes in. So integrative psychiatry has these four components that we'll talk about that make it better than standard psychiatry and will allow you to treat complex conditions with less side effects and have patients have better outcomes. And an additional benefit is that it will help you market your private practice better. So let me tell you a story. When I was in my residency and fellowship, so five years of that, we never once covered integrative psychiatry. The standard treatments were all medication based and some therapy, but usually it was a referral. Okay, you go here, or you go to inpatient setting, or you go to rehab or outpatient, whatever it might be. But the general standard treatment for a psych provider is psychopharmacology. And then I joined an integrative private practice mentorship group. And in this group, I learned how to set up my own private practice, but the leader really advocated for treating patients in an integrative manner, meaning using things rather than just medications to help patients get better. And so I started using that philosophy and method in my patients. And lo and behold, I found that they were getting better quicker and I needed less medication as a result. And so that made me a believer. And so now that's how I practice integratively. And so I'll share with you here the four components of that. So the first one is supplements. I remember one time I was a first or second year resident, and my dad calls me and he says, "Hey, I'm at Costco and there's these CoQ10 supplements here. I've heard they're good for the heart. Should I get them?" And I was like, "No, they're supplements, they're a complete scam. Forget all that. Just go to your PCP and get whatever medications that they suggest." Now I look back at that, I'm like, okay, I don't fully agree with that. Of course, medications have their place, but there are certainly natural supplements that have evidence to help out specific conditions. For example, in psychiatry, things like saffron, magnesium, L-theanine, ME, L-methylfolate, all of these are omega-3s, all of these are evidence-based supplements that I use in my practice to help patients get better. Creatine, huge example. And I think the reason that most doctors and providers don't use supplements is because of the academic system. So if you think about how we learn psychiatry, it's from mentors, peers in the academic system, right? I was part of a university system. And the way the university systems thrive is by publishing studies and papers. Who funds these papers? Pharma. What are the most vast majority of these papers based on? Pharmacology. And so how do academics' careers advance and how do institutions advance? By publishing those studies in pharmacology. So you see how the whole system is designed to teach that medication first, medication only philosophy. And so that's why it's not providers' fault, right? You learn what you're taught from people ahead of you. And so once I realized this, I was like, okay, so that makes sense, but there's a whole lot to the picture that I am missing. And so the thing with supplements is that supplements have biological effects too. So just like medications have specific biochemical pathways that they follow and regulate in receptors, supplements do the exact same thing. For example, L-methylfolate is a supplement that can be used to help make dopamine, norepinephrine, serotonin. but the body may not be able to convert folate to L-methylfolate because there's an enzyme called MTHFR that does that. Now, if that enzyme is not functioning properly, then you're going to have less L-methylfolate and thus less of those neurotransmitters. So by supplementing, we can help replace that. Or people might have vitamin D deficiency and other things, and so supplementing can help replace that and thus help out the patient's natural processes function better. Supplements also are very helpful for mood, sleep, nervousness, focus. Supplements can be used on their own, or they can be used as augmentation to help medication treatment. And that's something I do very frequently. For example, if I have an OCD patient, supplements are not enough to treat OCD, but I'll do a SSRI and N-acetylcysteine because that will get the patient faster results than just purely an SSRI. With supplements, they tend to have decreased side effects, which is nice, but the downside of that is they tend to have a decreased effect size too. Supplements also tend to have less evidence than medications do, but that's because they're also less studied. There's no incentive to study them. Overall, I think that supplements have their place in integrative treatment. I'm not saying they can replace all psychiatric treatment, but they can be integrated into the full treatment of a patient. So that's number one. So number two is testing. So testing is a big component of integrative psychiatry. That example I mentioned with the MTHFR deficiency, I've had patients who have gotten better because we've supplemented L-methylfolate to help them. I remember I had this other patient and she came to me, she was on modafinil for low energy. And I said, you know what, let's do your blood work. It's been some time. And so I ordered iron studies on her. And so it turns out that she had a ferritin deficiency, and turns out that she had slight microcytic anemia, meaning that she had iron deficiency anemia, and that was contributing to her lack of energy. And so I said, okay, let's supplement you also with iron as well. And so she did that. And then in 2 months, she said, wow, like I have way more energy than I did before. I've had other patients who have had vitamin D deficiency. They've had zinc deficiencies, omega-3 deficiencies, testosterone deficiencies, that when we've corrected those, their symptoms have naturally gotten better. And that's because of testing. So what you have to understand is the vast majority of blood work that providers order is very standard basic stuff. CBC, CMP, like lipid panel, A1C. And so patients will think that, oh yeah, I got blood work, I'm good. And providers will think this too. No, with blood work, you have to know what you are looking at and you have to select the things that you want to see. For example, if I want to assess nutritional deficiencies, I'll order magnesium, red blood cell, zinc, copper, omega-3, iron, because all these are easy, folate, all these are easy to correct and they can make a huge difference for patient outcomes. If I'm looking up hormonal stuff, then I can test testosterone, estrogen, vitamin D, prolactin, insulin, right? If there's any deficiency, for example, in testosterone, I've had patients who have helped increase their testosterone, and lo and behold, now they have more drive, more motivation, more energy. There's inflammatory markers like CRP and ESR. And when I said, okay, let's focus on decreasing the inflammation with things like omega-3s and curcumin, then that's helped out their depression and anxiety symptoms, because I'm a big believer that inflammation is a big contributor to psychiatric illness. If I've had patients who have had gut microbiome dysbiosis, so I've helped correct with fiber and probiotics, and so in a healthier diet. And so when we do that, their gut health gets better, and immediately with better gut health comes better anxiety. So you see how testing, we can identify any kind of gaps that patients have in their body's biological processes and fill them in. There's also organic acids testing, neurotransmitter testing, genetic testing, which I consider as augmenting. They're not necessary by any means, but they can provide more information to a patient, help increase the patient's motivation for treatment too. I've had cases where the patient doesn't feel motivated, then I show them testing. And now from that testing, okay, yeah, I should take my gut health more seriously, for example. It's an example of, I remember when I was in an earlier time, I was trying to lose weight and I was finding it hard to stick to a specific diet, and I'd reached a plateau. And then I got a DEXA scan And then the DEXA scan showed that I was still having a higher body fat percentage than I wanted to. But when I saw that number, that motivated me to go, oh yeah, I need to definitely lock in. Whereas like before, like I could still look at myself visually and be like, okay, I need to lose weight, but it wasn't the same. That DEXA scan gave me that extra motivation, and that's what the testing can do. So then number 3 comes therapy. And I remember when I was in my 3rd year of residency, and so we were seeing patients back to back, and these were all mainly medication management visits. And there were some patients where let's say I'd see them for 10 minutes and we might make an adjustment or they were doing fine. And I would say, okay, see ya. But then I would have 20 minutes of the session left. And I just remember thinking like, wow, like I feel like I could have done more for this patient. And so I talked to our psychology professor in our department. And so she said that, yeah, I can actually start using therapy in my medication management visits. And that was a whole breakthrough for me. And so I learned about the different types of therapy like cognitive behavioral therapy, supportive therapy, dialectical behavioral therapy, motivational interviewing, exposure therapy. For example, I had this guy who had social anxiety and he wanted to go out, he wanted to make friends, but he was too anxious to. And so we use CBT principles where thoughts, feelings, and actions are connected. So I told him that, yeah, these negative thoughts that you have, these anxious thoughts that you have, they're preventing you from taking the action to go out and meet friends and have the outcome you want. But if you go out anyway, then that's going to help your thoughts and your feelings to get better, and it's going to be a positive cycle, like basic CBT stuff. I had a patient who had OCD, and so he would always want to touch the walls before he left the room. Another patient who would always want to check the stove 5 times, make sure it was off before leaving. And so we did basic exposure response prevention, where, hey, we have the exposure to the stimulus, either the walls or the stove, but we're going to prevent ourselves from doing the response, which is touching the walls or checking the stove more than once. And so by doing that, we're helping treat the OCD directly. I've had other patients who haven't been motivated to quit smoking or to start medication or to make a lifestyle change, like they sort of want to, or they might have tried it, but they're not committed to it or they're not consistent. And so I use motivational interviewing to help them, help increase their motivation. I've had patients who I just use supportive therapy in my sessions to help increase their coping skills and how they're feeling about day-to-day situations and helping boost their self-esteem. Point being is that we can utilize a lot of therapy concepts in our sessions to help patients get better. We can integrate these into our psychiatry practice. And then number 4 is lifestyle. So when I was in my 3rd year of residency, I was asking patients about their sleep. And not once did I encounter a patient who said, oh yeah, I sleep 8 hours every night and I feel very rested each day. No, patients always told me that they slept 4 hours, 5 hours, 6 hours. They would get up throughout the middle of the night. They'd be watching TV late into the night. Always there was a sleep problem. And so that's when I realized that, sleep is so correlated to these mental health symptoms because I just kept seeing it again and again. So I started doing sleep coaching in my sessions where I would talk about, okay, this is sleep hygiene, and we want to make sure that the TV is not in your bedroom. You want to make sure you have cool sheets in your room, not scrolling your phone right before bedtime, things like that. And so as my patients' sleep started to get better, lo and behold, they started feeling better. And then I started expanding that to diet, to exercise, to meditation, to gratitude journaling. These kind of interventions can really make the difference between a patient getting 50% better and 80 to 90% better. If you think about a personal trainer, the average personal trainer is going to basically go through the exercise with you at the gym and then that's it. But we all know that's not going to be enough to achieve fitness goals. Diet plays a huge part, sleep plays a huge part, stress plays a huge part. And so the outstanding personal trainer is going to, in the session where they might be doing the workout, is going to be talking about things like diet and exercise and sleep, etc. And that will help the patient get so much better results than if they just purely cover the exercise. So similarly for me, like I like to focus on sleep, diet, exercise, meditation and mindfulness, and gratitude in that order to also help my patients get better. And these are easy interventions that you can integrate into your treatment. And I find that if you do these 4 things into your current practice, because medication, I don't think medications are bad. I think that they can be integrated as a part of a whole treatment approach. Then you're going to help patients get better results. You're going to have less partial responders. You're going to have less side effects because now patients will need to be on less medication dosage. They're going to be on medication for a lesser duration, and it's going to be easier for them to come off their medication. So I hope that this makes sense, and you've probably thought about ways to integrate this into your practice. And if you want to learn about the details of therapy, how to use in your practice, the types of testing that I order, the types of supplements that I use, the best way to do that is to, especially if you're a Psych NP, is to check out our Level Up Psych Academy, where I have a complete system on how to practice integrative psychiatry so you can get better results for your patients. So definitely check that out. Check out the video that's linked at the end of this one for more content, and I'll see you there.